Chair thanks the gentlelady. Now recognizes Dr. Cassidy for 5 minutes for questions.
Thank you all for being here. Ms. Lavelle, WellPoint has MA plans, and do you have the same level of fraud, waste, and abuse in your MA plans that you administer for CMS as is reported to occur in direct fee-for-service Medicare?
That's difficult to answer, Congressman. We're very vigilant with our MA plan. We have a lot of rigorous applications, data mining programs we run against it. One of the common denominators and one of our biggest issues is the any willing provider clause that allows any willing provider to bill.
Are you allowed to do pre-certification, pre-authorization, even if you have an any willing provider?
On certain procedures, yes.
So, okay. So you're not sure, possibly, but just not sure.
Well, I'm not certain if our level of fraud in MA is the same as CMS.
Gotcha.
It's just hard to determine.
Okay. Now, everybody's familiar with McAllen, Texas, immortalized in the New Yorker as a place of a lot of CMS fraud, waste, or abuse. But there's a health affairs article, first author is Franzini, looking at the Blue Cross population. And in this, actually, McAllen, Texas had a 7% lower utilization rate than El Paso. Now, it seems like if Blue Cross is 7% lower in a place where, I forget the exact number, but where McAllen is like 180% higher than El Paso, that the problem is CMS, frankly. And the authors of the paper at the end postulate what could be the problem. Some of them are reflected in your GAO report. Would you like to render an opinion on that?
I'm not familiar with the article, so yeah. I'd rather not.
And what would be your estimate of why Blue Cross Texas has 7% lower expenditures in McAllen, whereas CMS has, again, I wish I'd looked at 80% or 180% higher than the cohort city, if you will, the comparison city?
I think we do have some sophisticated tools in place that stop the dollars before they go out the door.
So that suggests that CMS does not?
No, I'm not suggesting they do not, but we are very competitive in the Blues, and we're very collaborative between states in warning each other, giving early warning signals. But we do have very rigorous special investigations.
Gotcha. The only reason I'm cutting you off is time's limited.
Okay.
And it does seem as if the Blues have something that CMS does not, which is a little daunting when we figure we're turning over our healthcare system to them. You mentioned in your testimony, I think it was you, about the dual eligibles being able to change Part D plans month to month, and so those seeking drugs will try and stay one step ahead.
Yes.
Do you have an estimate of how much money we would save? Because prescription drug abuse is a huge problem.
It is.
Do you have an estimate of how much we would save were we to limit that activity?
I don't have an estimate, but I can tell you that a single provider that we lock into place with a single ER for non-emergency use, we could save at least $300,000 to $400,000 a year, based on
$4,000 what?
Dollars a year per member.
Per member.
For locking them in. They evade the lock-ins by jumping from WellPoint to Humana to Aetna.
You would save $300,000 per member per year?
For every dollar we spend on drugs, we've determined that we spend approximately $41 on facility fees.
And any clue the size of this population that you would save $300,000 per year on? I mean, is it 1,000 people? Is it 1,000,000 people?
It's hard to say, but it is a
ballpark.
We probably have 1,000 right now that we're monitoring, and we just don't have the manpower to monitor.
1,000 times 300, we're talking real change here,
yeah.
For one company, granted
Right.
a big one. Dr. Fu, I really liked your testimony, man. I'll tell you, the TWIC card was supposedly going to be the answer for all security problems, and I get regular complaints from people fighting about the TWIC card. And I like the way you kind of, if you will, puncture a couple holes in its foolproofness. Is there anything short of a retinal scan that could actually make a secure ID card? Because you mentioned if somebody gives their card to somebody else, and they can take that number, et cetera, et cetera.
Thank you, sir. Identity is very difficult to establish. In computer security, there are three basic ways to do it. You can use something you have, like a smart card, something you know, like a password, or something you are, like a fingerprint. Whereas we also like to call it something you lost, something you can't remember, and something you were. But I would say that the difficulty is in how the smart card system is used in the greater system. So it doesn't matter if you have the most secure technology or even if there is a flaw, if that system is put as a component in a larger system that it itself has flaws. For instance, a paper-based alternative system would leave that door open to fraud.
But still, within that, there has to be, and you point that out, there has to be things about the card itself, even in a perfect system, that can make that system vulnerable. So I go back to, again, is anything besides a fingerprint or a retinal scan going to give you the assurance that somebody sitting at a computer terminal is just not filing claims for things not done?
Unfortunately, despite decades of research in computer security, there is no silver bullet. There is no surefire way to establish identity. I think one of the reasons that certain identity cards work well in buildings is that you may have police nearby, or people watching, or people with who would catch you. So I don't have a good answer for you on what would work better. I do think it's a good idea to try different alternatives because different contexts, you will see different technologies having different advantages.
Thank you, Mr. Chairman. I apologize for going over.